Hi people, it's me Dr. Essie. In this my video, I'm going to be talking about the risk factor for infertility for women. In my next video, I may talk about men, but in this video is for women. Those days, they used to say a woman that does not have a child is because she has been wayward, she has damaged her womb. But I'm glad to say that's not true. Science has made us to know some of the risk factors that can affect the fertility of a woman, and the most common one is age. We can see those days where our mothers used to get married early, infertility was not a big issue. But now, where we have to go to school, we want to be established before we get married, so we don't get married on time, and so the rate of infertility in our generation is higher. Then again, anything that has to do with that affect the ovulation, anything that affect the ovulation of a woman, we know that ovulation has to do with releasing of egg that can help infertility. So anything that can affect ovulation, there we can talk about premature ovarian failure. We can talk about a polycystic ovarian cyst. We can talk about thyroid function. We can talk about prolactinemia, hyperprolactinemia. Anything that can affect the chemicals that leads to ovulation can also cause a woman to become infertile. Then we talk about tubercles. Now we know that for the egg to get fertilized, the tubes have to be okay. So anything that can affect the tube of a woman can lead to infertility. Now we talk about pelvic inflammatory disease, we talk about STI, and that's why I usually tell women that any infection that has to do with down there, you have to treat it aggressively because our tubes are very tiny and any little thing can affect the tubes. So anything that can cause tuber blockage can affect that. Then endometrial lining. If you can remember my anatomy of the uterus, I talked about the endometrium, and that's where implantation takes place. So anything that can affect the endometrial lining, you talk of endometriosis, you talk about adhesions, anything that can affect that lining can also cause infertility. Then we talk about we also have to talk about medical conditions. Medical conditions here, diabetes come here again, autoimmune diseases, anything that can these are medical conditions that can affect fertility. Then again, we talk about structural problems. Anything that can affect the structure of the uterus can also affect fertility. Then we talk about lifestyle, smoking. I don't want to go into details. You can also consult if you want to find out the details. You can also consult me. Then we can talk about the details. Lifestyles can also affect the fertility.